or pharmacist about the composition of IV fluids, purposes of administration, potential incompatibilities, possible adverse effects, and the most appropriate type of catheter to use. Next, once you've determined the gauge of the IV that you've wanted, you can go ahead and gather your supplies from your facility's supply room. This is just an overview of general supplies needed. Every facility is going to be slightly different because you have this one right here, which is an IV start kit, which contains some tape, some gauze, your tourniquet, and some cleaning agent. But each facility, again, is going to have different items within their kit, so you're going to want to know what's in your facility's kit. Over here we have IV extension pieces, and this end right here will go on the end of the IV catheter, and this end here will be what we will hook up our IV fluids to, or if we just leave it as what's called saline locked, which is just going to be that, and we want to tape that to the patient. I'll show you that later. This is what's called a pigtail, and that actually has two different ports there. Of course, you're going to want to have gloves available. You're going to need alcohol swabs, and then you're going to want to have a sterile syringe to prep the IV extension piece. And then these are just the two gauges of IVs that I've pulled here. You can tell that this one is a 20 gauge. This is the front and the back. So on the back it says 20 gauge, but on your patient, if it's already inserted, you can go ahead and look at the color. The color of the 20 gauges is this reddish pink color. And then a 22 gauge, which is a smaller needle, is going to be this very light blue color on your patient. So you can always identify that. You're also going to need some tape possibly if your kit doesn't have it. And then I highly recommend some sort of towel or a chuck or something to put underneath the patient's arm to protect their clothing and bedding in case some blood leaks out or some fluid runs. So these are your general supplies that you're going to need, and you can take them into your patient's room. So I'm here with Alan Covey, and I'm going to start some IV therapy on him. So I'm assessing the extremities for appropriate placement of the IV catheter and identify any contraindications prior. I'm going to confirm a complete history of allergies, medications to alcohol, chlorhexidine, latex tape, or local anesthetic, and that will assist in which supplies I'm going to use. I'm going to assist the patient to a comfortable position. That can either be sitting or supine, but also remember to give yourself the best access to the veins for the patient. Perform hand hygiene, and I'm going to just go ahead and assess this arm for some sites. As you can see in the hand, we have lots of veins, but you can see they're kind of squiggly, which kind of makes them hard. And again, the wrists aren't the best ones to use. So up here we see this one. This seems like a very good one, so we kind of feel it with our fingers to see. And you can see it kind of goes that way underneath. So then I'd ask the patient to kind of turn their arm, and I can kind of follow it. And then as you can see, it kind of disappears. So then I can choose that one, but because of the angle, I might choose a different one. And so I'm going to continue to look to see if I can find anything. And it looks like I got a straight vein right here that goes up here, okay? And I'm going to probably go right around in here. That's where I seem it to be most prominent. I've opened up my IV start kit, and again, just to re-emphasize, each IV start kit at a different facility is going to contain different material. So this is just the example one that we have here in Skills Lab. So I've opened it, and I kind of tend to keep it in its own little package because that's a sterile environment, so that way I don't have to worry about any contamination when it touches the table. So we found a pretty easy access vein on Alan Covey on our practice arm, but in the hospital it might be a little bit more difficult. So what you'll want to do is go ahead and grab your tourniquet, and then you're going to go ahead and apply it to your patient. And when you do that, it will make some veins up here, hopefully. So you want it to be tight. You don't want to tie a knot exactly, because if you tie the knot, you want to be able to do a quick kind of release on it. So just like that, in case something were to happen. So again, I'm going to go ahead and just tie it, pull it pretty taut there, take take one underneath and just make that little loop there, and then it'll hold like that with that loop. And then you can have them do a couple fist pumps, and that will pop out the veins a little bit. And then you'll just go ahead and continue to find a vein. And once you found the one that you're gonna use, then we're gonna release that tourniquet for now while we move to the next step, which is the cleaning portion. So for the cleaning step, there's alcohol swabs in the IV Start kit, but there's also this chlorhexidine prep. Sometimes the kits come with these, and so that's what I'm gonna be using today. I'd already taken the top off. And then you have this thing right here, and it has these two wings on the side. And so what you're gonna do is you're gonna press them together, and that releases the solution down into this sponge portion. See, as you can see, it's kind of filling up. And so then you can kind of shake it a little bit, and then that sponge will get us prepared. So I know where my vein is. It's gonna be approximately right in here. So we're gonna wanna clean the area, and we're gonna go center and then wipe outwards, okay? So start with the center and then wipe outwards, okay? And then I'm gonna let that dry. The next preparation step I'm gonna do is go ahead to prime the IV extension tubing with the normal saline, and this is what's gonna be screwed onto the catheter tip. So I have my extension piece here, and then my sterile saline flush. So you want to be careful while you're holding this. You want to keep it as sterile as possible. Get that little air bubble out of the saline flush. This is sterile, but you can also wipe it with alcohol right there. That's going to be the port that we're going to inject it into. And then essentially you just stick it on just like this, and then you just turn it clockwise, and it'll stay right on there. The end here, you have a plastic tip. I'm just going to take that off temporarily, and then I'm going to just go ahead and fill my tube with a saline until I get some liquid that's going to come out of the, you can see the bubble right there. Okay, then I'm going to recap it now that it's flushed because it has the saline in it. All right. Put that back into my sterile kind of kit there, as you can see. So it's just kind of hold in place. And just as a reminder, I do have the tourniquet off. When you're learning, that's something that people sometimes do, is you forget to leave the tourniquet on the arm. When you're prepping everything, after you found the vein, you clean, then you can finish prepping, but make sure that tourniquet is not on the arm until you're actually ready to insert that IV. So the arm is now clean. I've reapplied the tourniquet. I still have visualization of the vein that I'm going to access. I'm going to check for a distal pulse down here. And then I am going, and next I'm just going to go ahead and insert our catheter here. Okay, so here's your IV catheter. This is a 22 gauge. Again, you can see by that blue color that represents that. It has a plastic cap on it right there as you're seeing it, and then you can see that little white, the little white bubble on top right there. Retract the needle, then you're going to push that, and then it's going to go into the collection chamber. You can do the upwards angle here, and then now I have my needle sticking out. Okay, so we want the bevel to be pointed up, so we're okay. Now you want to go at a small angle, maybe 5 to 15 degrees here, because you don't want to push all the way through the vein. And this vein seems to be pretty superficial on top of the skin, so we're going to go at a pretty light angle here. All right, so I'm going to go ahead and just press it in a little bit. And then I get a flash. You'll get a flash in this little chamber right here. And then once you get the flash, then you know you're in the correct spot. There's your flash right there. And then what you're going to want to do, as I move this back, is you don't want to advance, you can advance the needle just a little bit more, and then sometimes you might want to take your hands and then push that catheter tip where it is. It's going to go right there, and then I'm going to hit this white button. Okay, so the catheter tip, you're going to hit this white button, and it's going to inject the needle back into the collection chamber. So again, once you have it in place, you're going to hit this white button, and the needle is going to get injected into this chamber here. And you're going to be holding it with more pressure. I'm just showing you so you can see the points of it. So you have your hand over here, and that's holding the catheter tip. And then again, I push that white button, and it injects. Then then you want to make sure you have pressure on this vein with this catheter tip. So your catheter tip is inserted, so it's going to look like this. If you don't hold pressure, you're going to get some blood that's going to be coming out of there, right? So that is why we hold tight pressure right there. So once I've inserted the catheter and I've removed the needle from the chamber there, then I make sure that you release that tourniquet, and then you have the pressure held on by the catheter tip right there, and then this is the tip I'm going to screw into the catheter tip there. So you're just going to go ahead and hold that, and that goes right on there, and it screws just like that clockwise. And again, you're holding pressure with this hand. So you're still holding the catheter tip in place. Lastly, you have your occlusive dressing. So next, we're just going to apply the occlusive dressing over the catheter tip. Okay, so I have this, and I'm going to go ahead and place it right over the catheter tip, just like that. All right, there we go. Now it's in place, it's held, as you can see. Then we're going to go ahead and there's a label within the kit. As you can see right here, IV site, needle gauge, and then you can put that on so it'll help with your charting. Once you place the occlusive dressing on the catheter tip, you can go ahead and finish by pushing your saline through, flushing it, making sure it's patent and it's not bubbling up on any of the patient. Then you have your little clip here. If it's going to be saline locked, you want to go ahead and just push it forward here before you remove your saline. Now it's in the locked position. No fluid or blood is going to run back out of this tube. So then you're just going to go ahead and unscrew this. And then this is pretty long, so you'll want to go ahead and put a piece of tape right across there. That way it'll remain in a good spot. So I'm going to go ahead and just put some tape right there. Now, just like that. So that's what it's finally going to look like. Again, with my label on there as well. Our tube, and as you can see, the needle is in here. And so, of course, this has to go in the sharps container. So that's something you're always going to want to do. Make sure you put it in the appropriate area. It's closed. Good. Continue to clean up all your supplies. Remove your gloves. Do hand hygiene. And then you're going to document in the patient record your placement of the IV. And then lastly, you want to educate the patient on how to move or turn without dislodging the newly placed IV that you performed.